Can existing drugs treat both long COVID and CFS? Can existing drugs treat both long COVID and myalgic encephalomyelitis chronic fatigue syndrome? This question is important for many people experiencing these conditions. Currently, there is no cure for either long COVID or CFS. However, some existing medications show promise in alleviating symptoms common to both. Treatments are often palliative and need to be tailored to each individual due to the complex symptoms involved. Several drugs that are used off-label or are being studied in clinical trials for CFS are also being explored for long COVID. These include low-dose naltrexone, pyridostigmine, beta blockers, immunoglobulin therapy, and central nervous system stimulants. Early reports from patients suggest these medications may help ease symptoms for both conditions, although more robust clinical trial data are still being gathered. Interestingly, long COVID and CFS share some features, such as platelet hyperactivation and changes in blood clotting. This has led to renewed interest in using antiplatelet and anticoagulant drugs for CFS treatment. New clinical trials are also testing anti-inflammatory drugs that were originally approved for other diseases to see if they can help reduce symptoms of long COVID. For instance, upadacitinib, which is approved for arthritis, and pirfenidone, used for lung disease, are being evaluated as potential treatments. There is also a growing interest in antiviral therapies, particularly those targeting herpes virus reactivation. This reactivation has been linked to both CFS and long COVID. Valganciclovir, an antiviral effective against Epstein-Barr virus, has shown some improvement in small studies involving CFS patients. Researchers are currently exploring combinations of antiviral drugs with anti-inflammatory medications for long COVID patients where herpes virus reactivation is suspected. Another medication under investigation is metformin, commonly used for diabetes. It is being researched for its potential to reduce the risk of developing long COVID and possibly CFS after a COVID-19 infection, although definitive evidence is still pending. In summary, while there is no existing drug specifically approved for treating both long COVID and CFS, several medications approved for other conditions are being investigated or used off-label to manage overlapping symptoms. Treatment approaches remain individualized, and ongoing clinical trials aim to clarify the safety and effectiveness of these drugs. It is essential for patients to consult healthcare professionals for personalized advice and to avoid unproven or unsafe therapies.